Okay, so today I'm going to demonstrate the removal of sutures and staples. I've already set up an aseptic technique wearing PPE and making sure that my sterile field hasn't been contaminated. So I'm just going to introduce myself to my patient and let them know what I'm going to be doing for them today. I'm going to ask first if they're in any pain and ask if they'd like any pain relief before we get started. I'm going to take the bandage off the wound and check for any signs of infection. Check the approximation of the wound, that it's healing equally on both sides. I'm also going to assess the colour of the wound, that it's healing properly. I'm going to make sure there's no offensive smells. If there is any odours, I would take a swab of that and I would send it to pathology for testing. So I'm going to start by cleaning the wound first, just with some saline. Being careful not to cross-contaminate. And I'm going to go ahead and remove stitches. What I'm going to try and do is remove from the inside first, grabbing both bunny ears and cutting just underneath the knot and then pulling it out. And when I get to this point, I just check to make sure that the wound isn't separating at all, and I'm happy that it's not, so I'll take the end stitches out. Sorry. So at this point I just checked again that the wound's not separating. I would document that it's healing well, that the approximation is good and that there's no signs of infection. I'm just going to move on now to taking out the staples. So again, I'm going to take off the bandage. And again, I'd assess the wound for any inflammation, for the approximation. And once I'm happy that it's healing well, I'll start to take out the staples, starting from the inside. Just push that on and clamp down. And before I take the end two out, I'm just checking that the wound's healing well. And at this point, I would educate my patient on, that they need to restrict the movement of the area where their wound is, that they need to keep their wound clean and dry, and just that even some nutritional facts on how to have better healing through their diet. And then I'd move into cleaning up my working area, making sure to dispose of what needs to go into the sharps bin into the correct bins, and that'd be it.